Meanwhile, spending on healthcare expected to surge over the next decade. A new report says that healthcare spending could be 1/5 of the U.S. economy by 2024. Joining us right now is the CEO of medical device maker Hologic. Steve MacMillan is with us. And Steve, it's good to see you. Thanks so much for joining us.
Great to see you again, Maria.
Do you see that kind of spending? Do you think this is a result of Obamacare? Why is spending continuing to dominate the U.S. economy, in your view?
Certainly, I think you have two things. One is innovation that's continuing to bring better products that people want and are life-changing, like our 3D mammography and other things like that. And the other piece is I think that the growing economy certainly has helped, along with, the backdrop of the Affordable Care Act and a little more coverage.
It's the billion-dollar question. How do you get healthcare costs down? You reported strong earnings. Tell us where the growth is at Hologic right now. You mentioned the 3D mammography machine.
Sure. It's, the best part is it was across the board, but our 3D mammography business is clearly driving it. Our breast health business grew over 20% in the quarter and really hit an inflection point. This is one of these great technologies. It's better for patients. We've talked about it before. It's better for patients and it's better for the healthcare system because it's catching cancers earlier. And everything we're doing as a company is really focused on early intervention, early detection. Because as you know, the more that we can detect things early, the quicker you can treat them, the easier you can treat them, the better for the patient. And frankly, it's a lot less costly than dealing with these things later. And our 3D mammography is clearly a big driver of our growth right now.
Obviously, Rudy, you had prostate cancer.
Yeah, I had prostate cancer and because of PSA test and something that didn't exist 30 years ago. And my father died of prostate cancer. I'm alive.
Yeah,
and we caught it 13 years ago. And so far, I go back every year and it's not there.
Yeah.
So thank you, God, and thank you, pharmaceutical industry.
Oh, thank you. And our diagnostics division does actually now some prostate cancer testing along with a lot of our sexually transmitted diseases and a lot of women's health, cervical cancer. You look at cervical cancer, that was the #1 killer of women a couple of decades ago. And today it's number 14 on the list. So the PAP test, as an example, which we've pioneered.
Are you having the same success with brain diseases like brain tumors and things like that, or is that still harder on the early detection side?
It's still harder. I think we're making progress as an industry in that area, but certainly brain cancers are some of the tougher ones.
We're on the doorstep right now of a huge revolution when it comes to the brain because of the last 15 years and the mapping of the genome. We know all about heart disease and that's the biggest killer. And we've made changes to our lifestyle. We're eating differently. We know what causes cancer in terms of smoking. So we know about that, but we don't know enough about Alzheimer's.
Well, that's going to be a big one, right?
Yeah.
Yes.
And about brain disease. But that's where we are right now, I think.
And brain tumors, because they're so difficult to treat.
Yes.
Because they're in a very sensitive area, and you can do more damage by treating it than anything else. Right?
Exactly.
Yeah, how important is the political environment and all the uncertainty right now for your business?
It's a challenge, but at the end of the day, I think I've always had a simple philosophy in healthcare is if you have a meaningfully different product and a meaningfully superior product, you can plow through that. But you play the political environment. There's this thing called the U.S. Preventive Services Task Force that's been out there, shedding some information around mammograms and, people should have them less frequently or not wait, basically wait until they're 50. That is,
what impact has Obamacare had on your business?
I think the best part for us is even as there's recommendations like that, at the end of the day, radiologists and women are seeing the real science behind it. And there was a new study, coming out of the UK this week talking about, mammograms at 40 are absolutely saving lives. So it's noise that we have to deal with. Yeah. But the true impact on our business, luckily, has not been that significant.
The medical device tax, I guess, is one of the more onerous parts that you're faced with.
Yeah, I should say that. And we, for those of you who've been following the medical device tax, 2.3% tax on revenues. Wow. Because our business tends to be more based in the United States. We've got a very strong U.S. business. We pay a disproportionate amount of that tax. And it's been really tough, especially for small companies, emerging companies. It is, as you know, because it's not a tax on profits, it's a tax on sales. It's a horrific tax for small companies.
How does it hurt research and development? How much of that 2.3% would go into research and development?
I think it varies by company.
Your company.
Let's say half.
Wow.
Wow, that's a big number.
Yeah, we've got to take that money from somewhere.
Right.
And I think what it's also done is, frankly, you've seen a number of companies in our industry shift jobs across, out of the United States because it's only a tax on U.S. sales. So it is, absolutely having the wrong effect. We have a government going after U.S. companies here, when, as you well know, every other country in the world, their governments are trying to support their business.
So how much does the FDA hold you back from cures that should be made available to doctors? So my doctor and I can think about that, even though the FDA hasn't quite approved it yet.
Yeah. I think the FDA in the last few years, especially the device part, is trying to make progress to catch up. I think you have a lot of products being introduced right now overseas first, as you well know.
Of course.
And I think they're trying to now, I think, start to cut that lag, because I think the pendulum had gone too far. I think the current leadership down there is trying to shorten that, but we're still at a competitive disadvantage relative to most of our products are approved in Europe, well ahead of when they come to the United States these days.
Any other trends in women's health that you can share with us right now? I mean, I think the 3D mammography is a really important point to bring up, because it really is much clearer than your traditional. You could see much more. Any other trends that you can share with us on women's health, since it's such a big part of your business?
I think we're seeing for cervical cancer screening, co-testing of both a traditional Pap test as well as HPV, so that you get, basically if you have the two tests together, it's even that much more accurate. And again, I think that those are things, everything we're bringing is trying to get more accuracy, better predictions, so that, we can give greater certainty to our patients.
A great story. Steve, thanks so much for joining us.
Great, thank you.
Steve MacMillan is CEO of Hologic. Rudy Giuliani, great to have you this morning. Thank you so much for joining us.
Thank you very much.